Hi, my name is Dr. Jacob Pogson, an audiovestibular neuroscientist. In this clinical picture for the Lancet, I describe a 57-year-old man who came to see Professor Michael Hamagi, a neurologist, because he was having difficulty hearing. This is how the patient described it. I first noticed the problem with my hearing about 5 weeks ago. First, it was a constant sound like trucks passing by. Then after a week or so, it began to be hard to hear what people were saying. Today, I can still hear fine. I can hear my wife speak, but I just cannot understand what she's saying. What's the problems with my ears? Diagnostic audiology and MRI were ordered. As you can see in the figure, audiometry found that there was a mild to moderate sensorineural hearing loss in both ears, with only a minor conductive component. However, the speech audiometry found that the patient was unable to repeat any phonemes and showed zero speech discrimination to both ears. This mild to moderate pure tone hearing loss could not account for his total profound speech comprehension impairment. The MRI found that a contrast-enhancing mass compressing both inferior colliculi. The inferior colliculi are part of the central auditory system. The general inability to perceive and identify complex sounds is called auditory agnosia, usually from bilateral temporal lobe lesions. The specific impairment shown here of speech perception is called verbal auditory agnosia, also called word deafness, and this is usually from bilateral superior temporal gyrus lesions, and rarely of the inferior colliculi. Remember that if a patient complains that they cannot hear, sometimes the problem is not in the ear,